You're lying in bed after a long day, ready for a peaceful night's rest. But just as you start to drift off, a sharp ache creeps down your legs, sometimes throbbing, sometimes cramping, sometimes burning like fire. If you're over 60, chances are, this scene feels all too familiar. But here's the truth most seniors don't hear from their doctors. This pain is not just part of getting older. In fact, in many cases, it's a sign that something deeper is going on inside your body, something that can and should be addressed. In this video, I'll break down the most common reasons seniors experience leg pain at night, how to identify them, and what you can start doing today to find relief. Because pain should not be your new normal. Aging alone is not the cause. Let's get one thing straight from the beginning. Aging is not a disease. Just because you've crossed 60 doesn't mean pain should become your daily or nightly companion. Yes, muscles do get weaker, and circulation slows a little, but constant nighttime leg pain is a signal that the body is trying to tell you something, and we need to listen. Some of the most common symptoms reported by seniors include sharp or shooting pain in the calves or thighs, cramps or spasms, especially in the middle of the night, burning or tingling sensations, often worse when lying down, a sense of restlessness or the urge to keep moving the legs, heaviness or pressure, especially after standing or walking during the day. These are more than just discomfort. They're potential warning signs. The nervous system connection. One of the most overlooked causes of nighttime leg pain is nerve dysfunction, and it's incredibly common in seniors. As we age, nerves become more prone to compression, damage, or inflammation. This can be due to degenerative disc disease in the lower spine, diabetes, more on this later, peripheral neuropathy, vitamin B1 deficiency, long-standing poor posture or muscle imbalances. When nerves are irritated, especially the sciatic nerve, pain can radiate from the lower back down into the legs, worsening at night when the body is at rest. Unlike muscle pain, nerve pain often burns, tingles, or pulses. It may feel like pins and needles, or as though your legs are buzzing from the inside. The hidden culprit. Another major cause of leg pain at night is poor circulation, often tied to vascular health. When the arteries in your legs become narrowed by plaque or cholesterol, a condition called peripheral artery disease, PAD, blood flow to your legs is restricted. During the day, you may not notice it much, but at night, when you're lying down, gravity no longer helps push blood down to your feet, and symptoms can become pronounced. Signs your pain may be circulation-related include pain or cramping during or after walking, claudication, legs that feel cold to the touch, especially at night, pale or bluish skin color in the feet, pain that eases when sitting up or dangling the legs off the bed. PAD is not just uncomfortable, it's dangerous. It can increase your risk for heart attack and stroke if left untreated. One of my patients, a 68-year-old retired teacher named Joan, came in complaining of annoying foot cramps that woke her up several nights a week. Her doctor had told her it was normal at her age, but after a thorough vascular exam, we discovered she had early-stage PAD. With simple lifestyle changes, magnesium supplementation, and walking therapy, she reported a 90% improvement in just 6 weeks, and hasn't had a nighttime cramp in months. The takeaway: don't ignore recurring pain. There's usually a reason and a solution. Nighttime leg pain isn't always the result of a serious disease, but even small imbalances in your body can create big discomfort when you're trying to sleep. In this part, we'll talk about the hidden causes that most seniors, and even some doctors, overlook: dehydration, low magnesium or potassium, restless leg syndrome, RLS, and medication side effects that may be sabotaging your sleep without you knowing it. Mineral imbalances, magnesium, potassium, calcium. Your muscles depend on electrolytes, minerals that carry electrical charges, to contract and relax properly. Two of the most important for this job are magnesium and potassium. As we age, our ability to absorb these minerals decreases, and many seniors are either eating less, absorbing nutrients poorly, due to digestive changes, losing minerals through diuretics or high blood pressure medications. When magnesium or potassium levels drop, the result is often muscle cramps, especially in the calves, twitching or spasms, aches that seem to move around unpredictably. One study in the journal Magnesium Research found that magnesium supplementation reduced nighttime leg cramps by 78% in older adults within 4 weeks. What to do? Add magnesium-rich foods, leafy greens, pumpkin seeds, almonds, black beans. Talk to your doctor about magnesium glycinate or citrate supplements, which are gentler on digestion. Add potassium from bananas, avocados, or sweet potatoes, unless on kidney medication. Don't forget hydration. It may sound too simple, but mild dehydration is a leading cause of nighttime cramps in seniors. Why? Because water helps carry nutrients into muscles and flush waste products out. Without it, the muscles become irritable and more prone to spasm. Also, many seniors intentionally drink less water at night to avoid nighttime bathroom trips, unintentionally setting themselves up for cramps and pain. Tip: hydrate earlier in the day. Reduce fluids 2 hours before bed, but make sure you're drinking enough throughout the day to support muscle and nerve function. Restless leg syndrome is a neurological condition that causes an irresistible urge to move your legs, often paired with tingling, itching, or crawling sensations deep in the limbs. It usually worsens at night and during periods of rest, disrupting sleep and triggering pain. While the cause of our LS isn't fully understood, it's linked to low iron levels, even without anemia, dopamine imbalances in the brain, chronic kidney disease or diabetes, use of certain medications like antihistamines or antidepressants. Signs: it could be our LS, pain or discomfort relieved only by movement. Symptoms: worse when lying still, trouble falling asleep due to leg sensations. Family history of similar symptoms. What helps? Mild stretching or walking before bed. Avoiding caffeine and alcohol in the evening. Iron supplementation with doctor supervision. Warm baths or heating pads on the legs. Are your medications to blame? Many seniors take multiple medications daily, and some of these can directly or indirectly cause nighttime leg pain. Common culprits include statins, cholesterol drugs, can cause muscle pain or cramping, diuretics, water pills, flush potassium and magnesium from the body. Beta blockers can cause circulation issues. Certain antidepressants or allergy medications can aggravate our LS. Don't stop any medication without speaking to your doctor. But if you notice leg pain worsening after a medication change, bring it up right away. There may be alternatives or solutions available. I once treated a patient named George, 72 years old, who had begun experiencing shocking cramps every night for nearly 6 months. He blamed old age until we reviewed his medications. Turns out he had started a new statin just before the cramps began. After adjusting his prescription and increasing his magnesium intake, the cramps disappeared completely within 3 weeks. The key takeaway from this section is simple. There's almost always a reason for your nighttime leg pain. It could be as small as not drinking enough water, as subtle as a slightly low magnesium level, as overlooked as an iron imbalance causing our LS, or as straightforward as a reaction to medication. But all of these are treatable, manageable, and definitely not something you just have to live with. Most nighttime leg pain in seniors is benign. It can be traced to dehydration, mineral imbalance, or minor circulation issues. But sometimes, it's a red flag that your body is dealing with a more serious medical condition, and ignoring these signals could put your health, mobility, and even your life at risk. In this section, we'll explore 3 major conditions that commonly cause nighttime leg pain in older adults: diabetic neuropathy, deep vein thrombosis, DVT, and spinal nerve compression. Knowing the warning signs can help you take action before it's too late. If you're over 60 and diabetic, or even pre-diabetic, your leg pain could be due to diabetic peripheral neuropathy, a condition where high blood sugar levels damage nerves over time. This type of nerve pain is often worse at night, especially in the feet or lower legs, described as burning, electric, or tingling, paired with numbness, weakness, or reduced sensitivity in the legs, sometimes accompanied by balance problems during the day. It may start subtly, a little tingling in the toes, but can progress to severe pain, loss of mobility, and even foot ulcers or amputations if unmanaged. What to do? Get your blood sugar tested, even if you've never been diagnosed with diabetes. Improve diet, cutting back on refined carbs and sugar. Ask your doctor about nerve support supplements, like alpha-lipoic acid, B-complex, or acetyl-L-carnitine. Regular foot care is critical, including checking for wounds daily. One of the most dangerous causes of leg pain, especially pain in only one leg, is deep vein thrombosis, DVT, a condition where a blood clot forms in the deep veins of the leg. Why is this so serious? Because if that clot travels to your lungs, it can cause a pulmonary embolism, which is potentially fatal. Signs of DVT: pain in one leg, often calf or thigh, worse when standing or walking, swelling, warmth, or redness in that leg. Skin feels tight or looks shiny, sudden cramping that doesn't go away. DVT is more likely to occur after prolonged sitting, travel, recovery from surgery, in people with limited mobility, in those with a family history of clots or who take certain medications, like hormone therapy. If you suspect DVT, seek immediate medical attention. Early treatment with blood thinners can prevent life-threatening complications. Not all leg pain starts in the legs. Sometimes, the root of the problem is in the lower back. Spinal stenosis, or narrowing of the spinal canal, can put pressure on the nerves that travel down into your legs. This condition becomes more common with age and is frequently misdiagnosed as leg problems, even though the real issue is in the spine. Common symptoms: leg pain or cramping that starts when walking or standing, pain relieved by sitting down or bending forward, numbness, heaviness, or weak legs, symptoms worse at night when lying flat. Spinal nerve compression, such as from a herniated disc or bone spur, may also worsen when lying in certain positions, leading to sleep disruption and nighttime discomfort. What helps? Stretching and physical therapy to relieve pressure. Sleeping with knees elevated or on your side with a pillow between legs. Medical imaging, MRI, to confirm diagnosis. In severe cases, surgical options may be discussed. Leg pain at night can also stem from inflammatory disorders such as arthritis, especially rheumatoid or osteoarthritis in the knees or hips, polymyalgia rheumatica, an inflammatory disease causing muscle pain in older adults, vasculitis, where inflamed blood vessels limit oxygen to tissues. These types of pain are often deep, aching, and hard to pinpoint, paired with morning stiffness or joint swelling, unaffected by movement, unlike our LS or cramps. Inflammatory conditions may require blood tests, imaging, and long-term management, but early detection can prevent permanent damage. Margaret, age 74, had been told her leg swelling and pain at night was just arthritis, but when she visited our clinic, we noticed the pain was only in one leg and came with redness and heat. An emergency ultrasound confirmed a large blood clot in her femoral vein. She was admitted the same day, and with the right medication, the clot dissolved without complications. But had she waited, it could have cost her life. Nighttime leg pain should never be brushed off as just aging. It could be a sign of something serious, or something easily treatable. But either way, your body is asking for attention. In the final section, I'll show you simple, doctor-approved solutions to reduce leg pain at night, including stretches, dietary tips, supplements, and safe home remedies that really work. Now that you understand what causes nighttime leg pain after 60, from mineral imbalances and medications to serious conditions, like diabetic neuropathy and poor circulation, the big question is, what can you do about it? In this final part, I'll share practical, doctor-approved solutions to relieve and even prevent leg pain during the night, so you can finally get the restful sleep your body deserves. These strategies are safe, effective, and backed by science. No gimmicks, no overnight miracles, just real results for real people. Gentle stretching before bed. Stretching is one of the simplest and most effective ways to prevent nighttime leg cramps and pain. Why it works: loosens tight muscles, improves blood flow to the legs, relieves nerve pressure, helps the body shift into a relaxed, parasympathetic state for sleep. Recommended stretches: calf stretch, standing against the wall; hamstring stretch, seated forward fold with a towel; ankle circles and foot flexes while lying in bed; knee to chest stretch, relieves spinal nerve pressure. Do 5-10 minutes of slow, gentle movement before getting into bed. Many seniors report a noticeable reduction in cramps within a week of consistent stretching. Stay hydrated the right way. We covered this briefly earlier, but it bears repeating. Mild dehydration is a major trigger for nighttime muscle pain. Aim to drink 8-10 cups of water per day, but front-load your fluids earlier in the day to avoid nighttime bathroom trips. Tips: add electrolytes, magnesium, potassium, sodium. If you sweat a lot or take diuretics, try coconut water or herbal teas with calming herbs like chamomile or lemon balm. Avoid caffeine after 2 p.m. as it's dehydrating and stimulates the nervous system. Magnesium, the muscle mineral. Magnesium plays a vital role in muscle contraction and relaxation, nerve signaling, reducing inflammation, supporting deep, restorative sleep. Most seniors are deficient, and it shows up as leg cramps, restless legs, and insomnia. Best forms of magnesium: magnesium glycinate, gentle on the stomach, supports sleep; magnesium citrate, helpful for constipation and cramping; topical magnesium oil or Epsom salt baths, direct absorption through skin. Talk to your doctor before starting supplements, especially if you have kidney issues. But for many, magnesium alone brings huge improvements within days. Eat more anti-cramp foods. Support your leg muscles and blood flow naturally with foods rich in potassium: bananas, sweet potatoes, spinach. Magnesium: pumpkin seeds, almonds, black beans. Calcium: dark leafy greens, tahini, sardines. Omega-3s: salmon, chia seeds, walnuts. And don't forget iron, especially if you have symptoms of restless legs. Add lentils, tofu, lean red meat, cooked spinach. Vitamin C helps your body absorb iron, so pair them together, like spinach plus lemon juice, or beef plus bell peppers. Adjust your sleep position. Sometimes, pain is simply caused or worsened by poor sleep posture. Try this. Sleep on your side with a pillow between your knees. Place a small pillow under your calves or ankles to elevate feet. Avoid lying flat on your back with straight legs, which can compress nerves and worsen back-related leg pain. For spinal stenosis or lower back issues, sleep slightly curled in a fetal position, which opens the spinal canal and eases nerve tension. Heat and cold therapy. Use a heating pad for stiff muscles or cramps before bed. Try a cold pack if your legs feel inflamed or swollen. Epsom salt foot soaks, 15-20 mins, can relax muscles and deliver magnesium through the skin. These methods may sound old-fashioned, but they work. Review your medications regularly. Always bring up new leg pain with your doctor, especially if you've started a new medication recently. The pain came on suddenly. It only affects one side of your body. There may be safer or alternative options that relieve your symptoms without side effects. Build a sleep and leg health routine. A simple evening routine could look like light walk after dinner, 10 minutes, warm bath or foot soak, 10-minute stretch session, herbal tea plus magnesium supplement. Elevate legs in bed with a small pillow. Your legs and brain will associate this sequence with calm, relaxation, and deep sleep. Leg pain is not a normal part of aging. It's a message. And if you listen to it, you can heal and sleep better than you have in years. The good news: most causes of nighttime leg pain are reversible, and with a few simple changes, you could dramatically improve your comfort, sleep quality, and overall health. If this video gave you clarity or relief, please like, share, and subscribe for more doctor-backed tips on staying healthy, active, and pain-free after 60. You deserve better than sleepless nights. Let's fix this together.